My name is Dr. Anna Reed. I am a faculty practice at Mount Sinai West. A gentle C-section is where the healthcare team has complete change in attitude about cesarean section, where they will focus on the family, mom, the partner, and the baby, more than the surgery itself. So, for instance, there will be a curtain to cover the patient from seeing the actual operation. But just as the baby is coming out, we can lower the curtain and there'll be a clear plastic window so the birth mom and the partner can see the baby being delivered. And oftentimes that we will take the baby towards the curtain so that they can almost touch their baby. And if the baby is crying vigorously, we will hand the baby to the pediatrician, and pediatrician can even assess the baby on mom's chest. So they will have this very special moment with the baby to share as if it's a vaginal delivery. Besides the fact that contraindication for vaginal delivery, such as a placenta previa or previous cesarean section that's more than twice, or other uterine surgeries or breech babies, there are two reasons why women in labor may have a cesarean section. One would be no matter what the doctor and the staff has done to promote vaginal delivery, the cervix just doesn't dilate, no matter what we have done to correct the problem. Or the baby head does not come into the birth canal and achieve a vaginal delivery. That would be what we will call it failure to progress or failure to descent. Another reason will be where baby's heart rate is so bad that we cannot assure a well-being of the baby if we allow the woman to labor longer. Mount Sinai West C-section rate is lower than everyone else in the New York City. It is about 28 to 33%, depends on the year, which is about 10% lower than average C-section rate in New York City. I think, number one, it is safer for mom to do a vaginal delivery, less blood loss, less stay in the hospital, and also it's healthy for a baby to come through the birth canal. It transitions better to the outside of the uterus into atmosphere. Also, vaginal birth is promoted because in the future, a repeated C-section can have a higher complication rate, such as the bleeding and injury to bowel and bladder. So it is safer for mom for the future pregnancy as well. NTSV is nulliparous, which meaning this is the first time mom is trying to have a baby. A S stands for singleton, which meaning it's not twins. T stands for a term baby. V is for a vertex, which meaning the baby is head down. VBAC is a trial of a vaginal birth after cesarean section. Well, there are a number of reasons why Mount Sinai has a lower C-section rate, because we have an early conversation with our patients to promote vaginal delivery during prenatal care. We also understand that many women requires more time to progress in labor. And we have a most up-to-date standard published guideline of when to diagnose failure to progress. We also have in our hospital a second opinion policy where a doctor wants to do a C-section for failure to progress, you need a second opinion to make sure that we have given every opportunity for a woman to have a vaginal birth. I think the woman who's looking to deliver a baby should look for a hospital that value vaginal birth and a low C-section rate. I also think they should look for a hospital that has a level 3 intensive care unit. That's to assure that an ICU can handle preterm infants. At Mount Sinai, we have level 3 and state-of-art brand new intensive care unit for babies.